All right, let's talk about the aging population. The current data says that there is 1 in 6 Australians currently aged 65 or over, and that is projected to increase to 1 in 5 by 2066. Why is it increasing? Because we obviously have better living conditions, longer life expectancy for all Australians, but also declining birth rates. So less people are having babies, and therefore it shifts more of the population into that older bracket. So the World Health Organization define healthy aging as the process of developing and maintaining functional ability and well-being into older age. What does that really mean? Well, if you're over the age of 65, are you independent? Are you able to perform daily functions without assistance? Are you mobile? So are you able to get around, not only in the house, but outside the house as well? And are you socially active? So are you still engaging, not only with like friends and family, but in community as well? That is really the goal of healthy aging. So what are the good things and the bad things about having a growing and aging population? So opportunities, we've got extended economic contribution, not only through paid employment, so people are working up until 67 and then past 67 as well, but also that giving back into the economic value of Australia through tourism, such as grey nomads. Challenges, obviously the strain on the healthcare system is quite significant and it is only getting worse, all right? We are experiencing this phenomenon called bed block because patients are in hospital and they need to be discharged from hospital to go to an aged care facility, but there's no spots in aged care facilities. So then they end up taking up a hospital bed, which could be used by someone who is younger and needs that bed for other types of surgery. Current strategies looking at increasing the amount of healthy aging that's happening in Australia. We've got national screening programs, so bowel cancer, lung cancer, breast cancer, etc. And the superannuation guarantee. So the government is paying into your life savings for later when you do retire. Future strategies, expansion of telehealth is a big one. The main one is going to be increasing the aged care workforce, facilities, etc. And also looking into some more dementia-specific care. So other than what's already been mentioned, what should the government be doing? Looking at sustainable funding. Obviously, we know there's going to be more aged people as we progress in our years, so we need to be putting more funding aside for them. But also infrastructure, and not only infrastructure is in aged care facilities, but infrastructure around the community to make sure that everything is safe for the aged population, ramps, rails, etc. NGO considerations, so the main one's going to be service delivery, making sure that services are being delivered so we can keep healthy aging people in their homes, all right, such as Meals on Wheels. Other ones going to be including social programs to ensure that they are still socially active, which is another positive measure against dementia as well. And that was your too long didn't study version of the aging population.